Food deficiency, definition, symptoms, what to do. The nutritional deficiency, whose medical term is nutritional deficiency, is an insufficient intake of nutrients for the body to be healthy. The most common are deficiencies in vitamin B9, iron, magnesium, vitamin D, calcium. Symptoms, consequences, treatments. The point. Definition. What is a nutritional deficiency? A nutritional deficiency, wrongly named food deficiency because it is a lack of nutrients, not food, as an insufficient intake in relation to the necessary nutrient needs, vitamins, trace elements, essential fatty acids, proteins, etc. for the body to be healthy. There are references of needs for each nutritional element. These are the Recommended Dietary Intakes ANC. We speak of deficiency or slight deficiency when the contributions are covered at 70 to 100%, of deficiency when the contributions are less than 70% of needs, severe deficiency when intake is less than 40 to 50% of needs, develops Dr. Laurence Plumey, Dr. Nutritionist, Hospital Practitioner, Antoine, Béclère Hospital, and founder of the EPM NUTRITION School. Deficiencies and deficiencies are more frequent in women than in men because the latter more often follow restrictive diets, which exposes them to the risk of deficiencies, she underlines. What are the symptoms? The more serious the nutritional deficiencies are, the more they are accompanied by symptoms. The common symptom of all deficiencies is fatigue, informs Dr. Laurence Plumey. Other symptoms depend on the nutritional element concerned. Lack of iron, for example, which concerns more than 1 in 2 women, is manifested by pallor, fine, dry and brittle hair, pallor, repeated infections. A deficiency in vitamins of group B is signaled by cramps, small neurological signs. Vitamin D deficiency leads to bone pain and risk of fractures, muscle cramps and tension. Difficulty concentrating. Vitamin D deficiency, B9 acid, folic acid, sleep disturbances, memory problems, depressed mood. Magnesium deficiency through muscle cramps and tension, dizziness, headaches, increased heart rate. Iodine deficiency through pale, dry skin, and the gradual onset of chilliness, constipation and weight gain. A deficiency in essential fatty acids including omega-3 is manifested by damage to the skin and hair. Symptoms of protein deficiency are a wasting of muscle mass, a drop in performance and a lower resistance to infections. Be careful. Calcium deficiency, common in women and the cause of bone fragility and an increased risk of fracture, does not give clinical signs and can make people believe that everything is fine. What are the causes? Nutritional deficiencies are most often due to a lack of intake. Thus, women lack iron, for example, because they do not eat enough red meat, offal. This deficiency in intake is also associated with iron losses due to menstruation and pregnancy. Diets promote nutrient deficiencies, especially when they are restrictive. Other causes of nutritional deficiencies are rare. It could be malabsorption due to chronic diarrhea or after a bypass-type operation in the event of obesity. This is why supplementation is systematic after bariatric surgery or even in the event of alcoholism or taking certain medications, antibiotics. A deficiency in an enzyme. For example, the enzyme in the intestine that activates vitamin B9 is partially active in many women, explains the doctor. How to diagnose it? The diagnosis of a nutritional deficiency is made with a dietary survey and a biological assay, informs the doctor. Biological assays are not always interesting. Thus the assay in the blood of calcium and magnesium are not good markers, while the assay of vitamin B9 and the assay of vitamin D are excellent markers, underlines she. What are the consequences? Nutritional deficiencies have many harmful consequences on health. In addition to fatigue, there is a weakening of the body, a lower resistance to infections. A deficiency in folate, vitamin B9 in pregnant women can cause fetal malformations. This is why women who want to become pregnant must supplement with vitamin B9, informs Dr. Plumey. Who to consult? First, if you show signs of nutritional deficiency, you must consult your doctor, who will conduct an examination and a biological assessment. If your deficiency is linked to dietary errors, it may be useful to consult a nutritionist or dietitian, informs Dr. Laurence Plumey. What are the solutions? In case of proven deficiency, the treatment consists of drug supplementation, initially a few months to raise the level of the nutrient concerned. All supplementation must be done on medical advice. You must then follow nutritional advice and in particular reintroduce the consumption of all families of foods, indicates Dr. Laurence Plumey. Thus, iron deficiency, very common in women, gives rise to drug treatment of iron supplementation for 1 to 2 months. sometimes supplemented by iron injections in a hospital environment. It is then advisable not to consume too much tea because its tannins prevent the absorption of iron, to consume 3 or 4 times a week red meat, offal, eggs, mussels, pulses, and to finish your meal with a fruit rich in vitamin C. Vitamin C improving the absorption of iron, indicates the doctor. Dr. Laurence Plumey reminds us that the best way to not miss anything is to eat a bit of everything.